Hey there, future nurses. It's your old pal, Bill Nye, here to talk about wound stitching. It sounds intense, but it's all about understanding the science and practicing the technique. As nurses, you'll encounter all sorts of boo-boos. Knowing how to stitch can make a world of difference. It's about promoting healing, preventing infections, and minimizing scarring. Think of yourselves as skilled craftspeople. With the right tools and knowledge, you can help the body heal. So, are you ready to dive in? Let's get stitching. Alright, before we start stitching, let's gather our tools. It's like baking a cake. You need the right ingredients before you begin. Here's what you'll need in your wound stitching toolkit. 1. Needle holder. This handy tool helps you grip the needle firmly and maneuver it with precision. 2. Suturing needles. These aren't your grandma's sewing needles. They come in various sizes and shapes, designed specifically for different tissues and depths. 3. Suture thread. This special thread comes in absorbable and non-absorbable types. Your choice depends on the wound's location and severity. 4. Scissors sharp and precise. These are essential for cutting the suture thread cleanly. 5. Forceps. These help you hold and manipulate tissues gently, ensuring proper alignment during stitching. Remember, always use sterile equipment to prevent infections. Now that we have our tools ready, let's move on to the exciting part, stitching. Okay, future nurses, let's break down wound stitching into manageable steps. Step 1. Clean and prepare. Ensure the wound is thoroughly cleaned and disinfected to prevent infections. Step 2. Anesthesia. Depending on the wound's severity, your patient may need local anesthesia. Step 3. Thread the needle securely. Step 4. The first stitch. Insert the needle through the skin and pull it through. Step 5. Knotting. Tie a secure knot to hold the wound edges together. Step 6. Final knot and cut. Tie a final knot and cut the suture thread. Remember, practice makes perfect. Start with simple stitches on models. Section 4. Safety first. Tips for safe and effective stitching. Hold on, future stitching superstars. Before you go stitching up every boo-boo in sight, let's talk safety. Remember, safety first, always. 1. Sterile technique. Maintain a sterile field throughout the procedure to prevent infections. 2. Sharp objects awareness. Be mindful of sharp instruments like needles and scissors. Dispose of them properly in designated sharps containers. 3. Proper hand hygiene. Wash your hands thoroughly before and after the procedure to prevent cross-contamination. 4. Patient comfort. Communicate with your patient throughout the procedure, explaining each step and addressing any concerns. 5. Know your limits. If you encounter a complex wound or are unsure about a particular technique, don't hesitate to seek assistance from a more experienced healthcare professional. Remember, your safety and your patient's well-being are paramount. Always prioritize safety measures and never hesitate to ask for help when needed. Section 5. The Master Stitcher. Confidence and competence in wound care. Congratulations, future nursing ninjas. You've reached the end of our wound stitching crash course. Now, go forth and practice your newfound skills. Mastering wound stitching is about more than just knowing the steps. It's about gaining the confidence and competence to provide the best possible care for your patients. It's about transforming from hesitant beginners to skilled healers, one stitch at a time. Remember, every stitch you make contributes to a patient's recovery, reduces their discomfort, and helps them heal faster. So, embrace the challenge, practice diligently, and never stop learning. Now, go out there and make us proud, future nurses. The world needs your skilled hands and compassionate hearts.